Okay, we're going to look at a teaching case here in the field of obstetrics. The patient presented with bleeding. I'll give you a chance to look through the images and you can make your conclusion.
Okay.
You done? Okay.
Well, no.
Not
Yeah.
done. Okay.
Okay. Okay. Oh,
Little surprise there for you.
yes. Okay. So it looked like there were two gestational sacs. One of the sacs had two embryos, and I did not see an inner twin membrane on that one cine clip. And in the other sac, I did not see any. It looked empty. And it also looked like it was in some sort of a either bicornuate or septated uterus, almost even possibly didelphys.
Okay, very good. Yes, that is correct. You could see all the way down to the cervix that there were two canals.
Yes.
So this is a didelphic uterus. And indeed, there were two gestational sacs, one with twins,
Mm-hmm.
and the other had no observable gestation. So this brings up the issue of reporting a disappearing twin.
Okay.
So look, I would not disagree that everybody would report this as a pregnancy that had one sac that had no embryo within it. But I can assure you that this turns out to be something that women respond to in an unusual way. I have literally heard a woman telling her child that her twin died in the womb. Now, for 2 million years of human existence, we had absolutely no way of knowing about disappearing twins.
Mm-hmm.
And yet now we are causing grief that is literally multi-generational. Not only did the mother have to suffer through the knowledge, but she's now telling her daughter that
Right.
her twin died.
Right.
So I really don't know what to tell you about this, but I have profound misgivings about the notion of the disappearing twin. So the issue of counting embryos versus counting sacs, I think, is a profound psychological and ethical issue. Obviously, here we have dichorionic, diamniotic twins.
Yes.
But here we have one embryo, one yolk sac, and an empty sac. This is the typical appearance, obviously, for the disappearing twin.
Right. Mm-hmm.
Okay? What would these sonographic findings have been for a monochorionic pair if the sonogram had been performed at 6 weeks? We have a monochorionic pair here,
Right,
obviously.
yes.
If we had scanned this at 6 weeks, what would we have seen?
When were we scanning it here?
Oh, probably at around 7 weeks. Okay, the embryos were just starting to be seen, so 6 weeks. Oh,
Right.
I'm sorry. Yeah, well, earlier than 6 weeks, then let's say 5 weeks.
Maybe the other sac you might have interpreted that as a small subchorionic bleed or something.
No,
Oh.
no, just the monochorionic pair.
Oh, you would have called it monochorionic twins.
No, you would have called it a singleton.
Oh, I see. If we were before that time.
Yeah, before that time.
Right, yes.
Okay, so when we see the thing we call a gestational sac,
Yes.
that was a term that came out of the the early days of ultrasound when we could see this little ring-like thing in the middle of a uterus,
Right.
and the lady subsequently turned out to be pregnant. So the early sonologists call that a gestational sac. But the real term for this thing is a chorionic sac. This is the rim of developing chorionic tissue
Right.
and the chorionic cavity.
Sure.
All right. So if you have a monochorionic twin, a monochorionic triplet,
Right.
you'll only see one sac
Sure.
when you start out. That's it. And you'll interpret that this will become a singleton pregnancy, but in fact, when you come back, you will find that it is indeed a twin pregnancy,
Right.
a monochorionic twin pregnancy. Let's take a look at it. So what is this tissue called?
Would you call it decidualized endometrium?
That is correct, decidualized endometrium. And you can see what is happening to some of the decidualized endometrium in the sac, in the horn that actually has the pregnancies. Look, if the patient decidualizes their endometrium and then doesn't get pregnant, what do they do? What happens to that decidualized endometrium?
It sloughs.
Sloughs, right. And look, this horn of the uterus isn't fully aware of what's going on in the other horn of the uterus.
Right.
And so patients with these kinds of uteri, duplicated uteri of whatever kind,
Sure.
have an opportunity, during the early course of their pregnancy, will frequently bleed, not because
Right.
they have the same issue of bleeding as patients who have a single horn in a pregnancy,
Right.
but because they're going to slough some of their.
Sure.
So bleeding doesn't have the same implications in these patients, in my thinking, that it does in patients who have a standard, normally developed uterus. Another thing that comes up with these uteri that are
Right.
have either two horns or are two separate uteri are the issue of interstitial ectopic pregnancy versus bicornuate uterus.
Mm-hmm.
So here you can see, one of these cases where there's clearly a bicornuate uterus with a pregnancy in one horn. And what do we see in this horn?
Same thing. Decidualized endometrium.
Now, it's a mature decidual cast. This term decidual cast frequently used in the world of the literature on ectopic pregnancy. The important thing is you can see myometrium 360 degrees around this. When you have an interstitial ectopic, you'll still have an empty uterus.
Right.
It will still have a mature decidual cast in it.
Right.
But when you track the myometrium, you'll see that it doesn't go 360 degrees around the developing pregnancy. One of the things that I try to get across to people that have an opportunity to see a case of a pregnancy in a bicornuate uterus, is that this is your opportunity to study mature decidual casts.
Right.
Okay? Because these patients all develop mature decidual casts before they begin to slough.
Sure.
And the mature decidual cast is your enemy when you're looking at cases of ectopic pregnancy.
Right.
So this is a chance to get a feeling for what these things look like. Take the opportunity. You already answered that.
Probably MRI historically, or no, 3D ultrasound.
Exactly. Look, MRI has been the go-to examination for this purpose, and to some extent it probably still is. But 3D ultrasound, with or without saline-infused sonography, are currently having a significant impact. And you can sort out a lot of things, so you can really get quite elegant images these days using 3D ultrasound to know what the interior of the uterus looks like. And you can certainly identify circumstances, as in this case, the one we're looking at, where you can see with certainty that this is a uterus didelphys with a large decidual cast in the non-gravid horn. And here we can see one of the sacs. I think that's the sac without the embryo. So
Right.
quite an elegant depiction of what's going on.